How to handle excruciating pain. Relaxing your body and calming your mind always helps decrease and help you cope with your pain, whether you're flared up or in need of ongoing pain management techniques. These range from those that can be done even when the pain is fierce to tools that you can utilize throughout your day and night, offering on-the-spot calm, release from anxiety, and a reduction in pain. It's crucial to have techniques that you will still be able to enact even if the pain is so high you can scarcely think, let alone attempt anything complicated. The many different forms of meditation to body scan relaxation, autogenic training, progressive muscle relaxation, diaphragmatic breathing, and other breathing techniques, self-hypnosis or guided hypnosis, visualization and creative imagery. There are many different techniques you can learn. Experiment with the above list and find something that works for you. Handling severe pain can be distressing and difficult. Sometimes pain can happen suddenly and unexpectedly, and sometimes the pain comes from an existing condition or illness. Breathing to calm the body and mind. Deep breathing is the cornerstone of relaxation practices and becomes all the more vital when living with pain. It can be combined with other relaxing practices including everything from meditation to aromatherapy to listening to your favorite music. The key in reducing pain through deep breathing is to breathe deeply from the abdomen, maximizing the amount of oxygen in your lungs. Taking deep breaths from the abdomen rather than shallow breaths from your upper chest means you absorb more oxygen. This results in your body being less tense, short of breath, more relaxed and calm, and less anxious. If possible, sit with your back straight, or if that is too painful for you, lying down and putting one hand on your chest and the other on your stomach is fine. Breathe in through your nose. The hand on your stomach should rise. The hand on your chest should move very little. Exhale through your mouth, pushing out as much air as you can while contracting your abdominal muscles. The hand on your stomach should move in as you exhale, but your other hand should move very little. Continue to breathe in through your nose and out through your mouth. Try to inhale enough so that your lower abdomen rises and falls. Count slowly as you exhale. Either way, there are ways to help you handle severe and excruciating pain. Stay focused on controlling your pain and find the techniques that work best for you. Managing pain that comes on suddenly. Stay calm. Experiencing pain is stressful, especially if the source of the pain is unknown. Feeling anxious, panicky, and fearful can actually make the pain worse. Shallow breathing can lead to hyperventilation, impair the ability of getting oxygen into the blood, and lead to more pain, like chest and muscle pain. Try not to focus on the pain. Focusing your thoughts and energy on the pain you are feeling can actually make it worse. Try to relax and focus on other things. For example, think about the next steps you need to take to address the problem causing the pain. Visualization meditation for relaxation and pain relief. Visualization, or guided imagery, is a variation on traditional meditation that requires you to employ not only your visual sense, but also your sense of taste, touch, smell, and sound. When used as a relaxation technique, visualization involves imagining a scene in which you feel at peace, free to let go of all tension and anxiety, thus reducing your pain, or at least your reaction to it. It's also a wonderful escape from the tough reality of living with severe chronic pain. Choose whatever setting is most calming to you, whether it's a tropical beach, a favorite childhood spot, or a quiet wooded glen. You can do this visualization exercise on your own in silence, while listening to soothing music, with a therapist or an audio recording guiding you through the imagery. To help you employ your sense of hearing, you can use a sound machine or download sounds that match your chosen setting, the sound of ocean waves if you've chosen a beach, for example. However, to begin with, guided meditations are perhaps the easiest to learn from. Alternatively, try the simple guidelines below. Find a quiet, relaxed place. Beginners sometimes fall asleep during a visualization meditation, so you might try sitting up or standing. Close your eyes and let your worries drift away. Imagine your restful place. Picture it as vividly as you can, everything you can see, hear, smell, and feel. Visualization works best if you incorporate as many sensory details as possible, using at least 3 of your senses. When visualizing, choose imagery that appeals to you. Don't select images because someone else suggests them, or because you think they should be appealing. Let your own images come up and work for you. If you are thinking about a beach on a tropical island, for instance, walk slowly around the beach and notice the colors and textures around you. Spend some time exploring each of your senses. Feel the warm sand between your toes, the sun on your back, the waves tickling your ankles, etc. See the sun setting over the water and all the colors of the skies. Hear the birds singing, palms swaying, sea lapping. Smell the flora and fauna. Taste the fresh, clean air. Enjoy the feeling of deep relaxation that envelopes you as you slowly explore your restful place. When you are ready, gently open your eyes and come back to the present. Don't worry if you sometimes zone out or lose track of where you are during a guided imagery session, just simply bring yourself back to the moment. Become focused by visualizing feelings and colors. Another technique when experiencing excruciating pain is to focus on something that soothes your soul. It could be the feeling of a soft and fuzzy blanket or a place that quiets your spirit. Even just play with colors. Visualize the colors of a rainbow flowing through you, from red to orange to yellow to green to turquoise to indigo to violet to white to silver to gold. Anything that will keep your mind focused instead of constantly being drawn back to the pain. Think about the feeling, the smell, the taste, if applicable, and the sounds of this color, object or place. Focus on what it looks like. Use all your senses to innerly describe your focus point, while distracting yourself from the pain. Recognize the pain, but don't give into it. Feel it like you were not in your own body. Put your mind and body in separate places. Control your breathing. Take slow, deep breaths that come from your belly or diaphragm, as opposed to shallow breathing from your chest. This helps to improve the flow of oxygen in your blood, and helps to quiet the intensity of the pain. Controlled breathing techniques are known to be effective in managing severe pain. Breathing techniques have been used for many years to help control the pain of childbirth. Assume a comfortable position and try to relax. Pain may be lessened by sitting in an upright and straight position, or possibly by lying down. Find a position that helps to reduce the pain so you focus on locating the cause of the pain. Don't ignore sudden, excruciating pain. In some cases, the sudden onset of severe pain may be the only warning you get that something is terribly wrong. For example, sudden onset abdominal pain may indicate a ruptured appendix, peritonitis, or a ruptured ovarian cyst. Ignoring sudden onset pain can lead to serious, sometimes life-threatening outcomes, if the need for prompt medical attention is ignored. Take action to control the problem. Once you have identified the cause of the pain, take steps to correct the problem if possible. Acute pain gets better, and can go away completely, once the reason for the pain has been resolved. Taking action to control the cause of the pain may include seeking medical attention. For serious injury or lingering, unexplained pain, medical professionals can help identify the problem and provide treatment options. Situations involving acute pain can last for a few minutes, or can linger for several months. Acute pain that goes unattended can turn into long-term, or chronic pain. Controlling chronic pain. Take charge of your pain. Managing pain requires a commitment to learn new techniques, and to practice what you learn. Meditate. Meditation is a proven and powerful way to address problems with pain. Learning to meditate requires instruction and a positive attitude to stick with it. Studies show that pain intensity can be reduced from between 11% to 70%, and the unpleasantness associated with pain from 20% to 93%. Think about food. Studies have shown that focusing on a favorite food can help to lower the feelings of pain. Focusing on chocolate is a big favorite. Allow yourself to be distracted. Chronic pain wants your attention. Focusing on other things, like watching a movie, enjoying activities with friends and family, reading, or starting a new hobby causes your thoughts to focus elsewhere. Simply focusing on other body parts also takes away from the attention going towards the feelings of pain. Visualize your pain getting better. Try to picture what your pain looks like, maybe imagine an arthritic joint, a pinched nerve in your neck, or the broken bone in your foot. Then imagine, or visualize, the area healing, or shrinking, or being less inflamed. Part of visualization also includes allowing yourself to mentally escape. Float away in your mind to a relaxing and restful place or a favorite past experience. Stay positive. Chronic pain is difficult to deal with since it is always with you and can constantly eat away at your positive attitude. Allowing your thoughts to become negative, dwell on the pain, and increase your feelings of frustration can actually make the pain worse. Try to stay positive and avoid imagining the worst. Consider talking to a counselor or therapist if you find yourself descending into negativity or becoming depressed due to your chronic pain. Research your condition. Understanding more about your condition can help with choosing the techniques best suited to your needs. Chronic pain can sometimes involve neuropathic changes, or nerve damage, that make it harder to treat. Knowing more about your condition can help to choose techniques that can provide some relief and avoid further damage. Knowing when to seek medical attention. See a doctor if your pain suddenly changes, or worsens. Treatments may be available to help manage changes in your condition. Treatment of pain should always first be directed toward identifying and treating the underlying cause before just symptom relief. If you have not seen a doctor about your pain, and your pain has been persistent, medical attention is warranted. Consider medical procedures. In addition to prescription pain medications, many procedures are available that are designed to treat conditions involving pain. Physical therapy, nerve blocks, localized anesthetics, acupuncture, electrical stimulation, or even surgery may improve your pain. Chronic pain symptoms are sometimes controlled by using nerve block injections that are performed as an outpatient. Let your doctor know if you are allergic to contrast dye, which is commonly used during the procedures. Depending on the site of the injection, common side effects include temporary numbness and soreness in the area of the injection site. Some procedures can result in droopy eyelids, temporary stuffy nose, and temporary difficulty swallowing. Recognize the warning signs specific to your condition. Chronic pain affects people of all ages, involves practically every part of the body, and includes hundreds of diseases. Keep in touch with your doctor. Follow your doctor's advice if your symptoms worsen. Try putting yourself in a relaxed, reclining position in a dark room. Either shut your eyes or focus on a point. Then begin to slow down your breathing. Breathe deeply, using your chest. If you find your mind wandering or you are distracted, then think of a word, such as the word relax, and think it in time with your breathing. The syllable re as you breathe in and lax as you breathe out. Continue with about 2 to 3 minutes of controlled breathing. Once you feel yourself slowing down, you can begin to use imagery techniques. 11 specific imagery and chronic pain control techniques that are effective for pain control include altered focus. This is a favorite technique for demonstrating how powerfully the mind can alter sensations in the body. Focus your attention on any specific non-painful part of the body, hand, foot, etc., and alter sensation in that part of the body. For example, imagine your hand warming up. This will take the mind away from focusing on the source of your pain, such as your back pain. Dissociation. As the name implies, this chronic pain technique involves mentally separating the painful body part from the rest of the body, or imagining the body and mind as separate, with the chronic pain distant from one's mind. For example, imagine your painful lower back sitting on a chair across the room and tell it to stay sitting there, far away from your mind. Sensory splitting. This technique involves dividing the sensation, pain, burning, pins and needles, into separate parts. For example, if the leg pain or back pain feels hot to you, focus just on the sensation of the heat and not on the hurting. Mental anesthesia. This involves imagining an injection of numbing anesthetic, like Novocaine, into the painful area, such as imagining a numbing solution being injected into your low back. Similarly, you may then wish to imagine a soothing and cooling ice pack being placed onto the area of pain. Mental analgesia. Building on the mental anesthesia concept, this technique involves imagining an injection of a strong painkiller, such as morphine, into the painful area. Alternatively, you can imagine your brain producing massive amount of endorphins, the natural pain-relieving substance of the body, and having them flow to the painful parts of your body. Transfer. Use your mind to produce altered sensations, such as heat, cold, anesthetic, in a non-painful hand, and then place the hand on the painful area. Envision transferring this pleasant, altered sensation into the painful area. Age progression, regression. Use your mind's eye to project yourself forward or backward in time to when you are pain-free or experiencing much less pain. Then instruct yourself to act as if this image were true. Symbolic imagery. Envision a symbol that represents your chronic pain, such as a loud, irritating noise or a painfully bright light bulb. Gradually reduce the irritating qualities of this symbol, for example, dim the light or reduce the volume of the noise, thereby reducing the pain. Positive imagery. Focus your attention on a pleasant place that you could imagine going, the beach, mountains, etc., where you feel carefree, safe and relaxed. Counting. Silent counting is a good way to deal with painful episodes. You might count breaths, count holes in an acoustic ceiling, count floor tiles, or simply conjure up mental images and count them. Pain movement. Move chronic back pain from one area of your body to another, where the pain is easier to cope with. For example, mentally move your chronic back pain slowly into your hand, or even out of your hand into the air,